Dan Yeatts, an OB/GYN physician with over 30 years of experience. I've delivered more than 4,500 babies. Let me share a crucial truth that I've learned in my career. A mother's intuition is one of our most powerful tools in prenatal care. I'm passionate about guiding you to harness the same resource to help you in your pregnancy. Today, I want to discuss something that's critically important that could save your baby's life. Did you know that 55% of stillbirths may be preceded by a detectable, significant change in the fetal movement? This staggering statistic is important because many of these losses might have been preventable with proper awareness and quick action. As a healthcare provider, it's my desire to enlighten and empower you with this knowledge to protect your pregnancy journey. First-time moms typically feel the baby movements around 20 to 22 weeks. These early movements may seem insignificant, but they're actually a crucial sign of your baby's health. Many second-time mothers recognize these early movements sooner. By 7 to 8 weeks, the baby's already moving and can be confirmed on ultrasound, though you can't feel it yet. These movements evolve from those early flutters to distinct kicks between 18 and 22 weeks. They become stronger and more frequent until about 32 weeks. New mothers feel a surge of movements, often described as fluttering or butterflies or even gentle bumps or kicks. If you're aware of these sensations, it may help you to respond when something isn't right. Here's what you need to know. A term baby typically makes about 30 movements per hour. We consider 10 noticeable movements within 2 hours as acceptable. Your baby's movement pattern is an indicator of their health. When it comes to interpreting your baby's movement, it's essential to understand the normal pattern of fetal movement. During my years of practice, I've noticed that babies often have their own unique schedules. They typically follow sleep cycles lasting from 45 minutes to an hour. Since they aren't aware of day or night, they can seem more active even when you're trying to rest. Now, several factors can influence your perception of your baby's movement. Your own activity level. The baby's movement may be hard to recognize when you're active. The time of day. The baby may be more active at night. The placental position. If you have an anterior placenta, it might make movements harder to feel. Position of the baby in the uterus. This can affect the intensity, frequency, and location of movements. The count to 10 method, or kick counts, is a simple method to check on your baby. Here's how it works. Choose a quiet time during the day, preferably after a meal. Lie on your left side. Count how many times the baby moves, whether it is a kick, jump, or bump. Most babies will reach 10 movements within 2 hours. This simple technique can be a means to encourage you about your baby's health. If it seems that your baby isn't meeting the expectations, don't jump to conclusions. Contact immediately your pregnancy care provider for advice. Interpreting fetal movement patterns is not always straightforward. Some mothers may feel strong, consistent baby movements, while others may experience shorter, more sporadic movements. It's helpful to pay attention to the patterns that your baby exhibits. For example, if your baby typically is very active at a certain time of day, but isn't as active at that time, bring up the difference to your pregnancy care team. Fetal movement patterns can change throughout the pregnancy. In the first trimester, you'll not feel any baby movements though the baby is moving. As the baby grows in the second and third trimesters, the movements become more consistent and stronger. Don't worry if your baby's movement seems more subtle or inconsistent in the early stages. That's normal. There's several factors that can influence fetal movement patterns, including fetal growth rate, placental health, the mother's weight or overall health, position of the baby in the uterus, and the gestational age. Fetal movement is not just a matter of noticing cute baby activity. Your baby's movement pattern is an indicator of their health. Your observation of regular baby movements is essential. And here's some key points to remember. A term baby typically makes about 30 movements per hour. We consider 10 noticeable movements within 2 hours as our safety benchmark. Fetal movement patterns can change throughout pregnancy. Several factors can influence fetal movement patterns. Now, don't assume that your baby's movement will always follow a predictable pattern. Keep an eye out for warning signs such as no apparent fetal movement, changes in movement patterns such as a shift from strong frequent movements to weak infrequent movements, a sudden decrease in movement after previously normal movement patterns. There are maternal symptoms that are important to report to your pregnancy provider as well. Some of these symptoms may also affect the baby: severe abdominal pain, vaginal bleeding, your water breaking, such as preterm labor. Your intuition is a powerful tool in prenatal care. By trusting your instincts and staying attuned to your baby's movements, you'll be better equipped to monitor your pregnancy journey. Now, here are some ways to cultivate your maternal intuition. Trust your instincts. Report any questionable changes in fetal movement to your healthcare provider. Prayer, meditation, and deep breathing exercises in a calm environment can help your intuition. Educate yourself about fetal movement and other pregnancy-related topics, such as with this video. Engage in self-care and stress management activities. Communication is vital in maintaining a healthy pregnancy. It's essential to stay in close contact with your healthcare provider. Report any concerns or significant changes in fetal movement. This will enable your pregnancy care team to monitor your baby's status closely and take any necessary actions to improve the situation. As a healthcare provider, my goal is to empower you with knowledge and confidence to take charge of your pregnancy journey. By understanding fetal movement and its importance, you'll be better equipped to make informed decisions and advocate for yourself and your baby. It's common for moms to feel anxious about the health and well-being of their baby. However, you don't want such emotions to negatively impact your physical and emotional health. Here are some strategies to help you overcome anxiety and fear. Practice self-care and stress management activities. Engage in relaxation techniques with prayer, meditation, or yoga. Stay connected with loved ones and friends. Seek support from your healthcare providers and other resources as Stork advisor. Educate yourself about fetal movement and other pregnancy-related topics. If you prefer help with technology, fetal movement tracking is possible. Apps like Count the Kicks offer another method to assess fetal movement. In fact, the implementation of systematic counting baby movements in Iowa reduced stillbirths by an incredible 32% over 10 years. By leveraging appropriate innovative tools, you'll be empowered to stay vigilant and proactive in monitoring your baby's health and development. There are several common misconceptions about fetal movement that can lead to unnecessary worse, a delay in seeking medical attention. Some of these misconceptions include thinking that fetal movements are always normal, steady rhythm. In reality, fetal movements can vary in intensity and frequency. Believing that all women feel fetal movement in the same time. While some may feel movements earlier and later than others, most women will begin feeling their baby's movements around 20 to 22 weeks. Assuming that all pregnancies are the same. Actually, every pregnancy is unique, so fetal movement patterns can vary from one baby to another. Maternal stress can have a profound impact on perception of baby's movements. Some believe that babies can sense whether their mother is under stress. This stress can possibly lead to a range of baby behaviors inside mom. Therefore, do not delay in connecting with your pregnancy care team if you perceive something isn't right. I hope this information has been helpful to you and your parenting journey. Try to keep a positive outlook. The fact that you're watching this video shows your commitment to be a great parent. This is Dr. Stan with Stork Advisor. Thank you for joining me today. See you next time.